Okay, everyone. Thank you so much for joining us today. We're going to go ahead and get started. And if you haven't muted your phones already or your computers, if you wouldn't mind doing that. And then there'll be a period for questions at the end, so you can unmute then and ask any questions if you have them. It also looks like everyone got the message that we sent out about just doing our bidders conference today over call and Skype. So thank you so much for your flexibility and responsiveness to that. We're just trying to minimize people having to come and meet in person. Just to make sure everyone's in the right place, this is the bidders conference for the Program Supports for Evidence-Based Senior Health Promotion RFQ. We had the bidders conference for the RFP for evidence-based senior health promotion programs last week, and this is the bidders conference specifically for the RFQ. And my name is Virginia Wise, and I work for King County in the Department of Community and Human Services on the Veteran Seniors and Human Services Levy team, and I'm the person coordinating this RFQ as well as the RFP from last week. Okay, so we begin our meetings with an acknowledgement of native land, and we would like to acknowledge that we are on the traditional land of the first people of Seattle, the Duwamish people and Coastal Salish people, past and present, and we honor with gratitude the land itself and the Duwamish tribe. And for more information, you can visit the Duwamish tribe's website at www.duwamishtribe.org. And this might be a little bit tricky to do over the phone and Skype, but we'd like to do a round of introductions. If everyone can just say their name and the organization you're with, we'd love to hear who's joining us today. So I think we'll start here with the folks in the room who are all staff of the levy, and then we'll move on to the call and the Skype participants. So as I said, my name is Virginia Wise, and I work on the seniors team of the Veteran Seniors and Human Services Levy, and I'm coordinating this investment.
Hey everybody, this is Adam Schmidt, helping run the technical supports. I work as the community liaison on the operations team.
My name is Tracy Adair. I work with Virginia on the older adult technology.
I can also read them out to you.
Okay. Yeah, maybe we can start with, we can see some of the names of people who, if you've joined by Skype, and then for folks who just joined by phone, we can't see who that is. So I think we'll start with the people on Skype. Adam, if you don't mind reading the names, and then you all can introduce yourselves, and then we'll go to the phone calls.
Great. Yeah, so we actually do have another staff person on the call, Mary Snodgrass. Mary, would you want to introduce yourself?
Oh, sure. Hi, Mary Snodgrass from Public Health Seattle in King County. And I'm a policy analyst here with the department and work closely with Tracy Adair on older adults issues in the county.
Thank you, Mary. We also have Michelle Yip. Michelle, would you mind introducing yourself?
Hi everyone, my name is Michelle Yip. I'm a research scientist from Providence. In my room, I have my colleague.
My name is Singing Park. I'm a research intern at Providence.
Thank you, Michelle. We also have Paige Dennison. Paige.
Hi, my name's Paige Dennison, and I'm from Sound Generations. I oversee the Health and Wellness Department and Project Enhance there. And Megan Thompson, our data manager, is also in the room with me today. Thank you.
Thank you. We also have Mi Young Lee.
Mi Young Lee from Korean Women's Association.
Thank you. Angela Miyamoto.
Hi, Angela Miyamoto from Aging and Disability Services.
Thank you, Angela. Marlana Cohn.
Hi, this is Marlena Cohn from the University of Washington Health Promotion Research Center, and I'm also joined by my colleague, Ann Turner. Hello.
Hello, thank you to you both. Leslie Haynes. And Leslie, I see you're on mute right now, so feel free to, if you'd like to introduce yourself. Okay, we also have Jerry Chang on the phone. Jerry, would you introduce yourself?
Hi, Jerry Chang with King On.
Thank you very much, Jerry. And then we have, looks like 6 other guests on the phone, Virginia.
Would anyone else who's on the phone want to introduce themselves?
This is Michael Wu with Kinan.
Hi, Michael.
Hi.
This is Mason Lowe with the Pike Market Senior Center.
Hi, Mason.
Hello.
This is G. DeCastro with Asian Counseling and Referral Service.
Hi, G.
This is Heidi with El Centro de la Raza.
Hi, Heidi.
Judy Anderson from United Indians of All Tribes Foundation with my program assistant, Alexa Turner.
Hi, Judy and Alexa. Okay, great. Thank you everyone for the introductions. So we're going to go ahead and get started here. And if you have any questions or you need anything during the course of the presentation, feel free to put a message write a message in the messaging box if you're joining by Skype. If you're just joining by phone, you can just speak up and let us know. Okay, so the agenda for what we're going to cover today, we're going to give a little bit of an overview of the Veterans, Seniors, and Human Services Levy. And then we're going to go to an overview of this investment and that should say RFQ, sorry, not RFP. Oh, okay. I got mixed up. We're actually going to be talking a little bit about the RFP since it's so closely related to the RFQ, and then we're going to go to the RFQ discussion. And then we're going to talk about ZOOMGRANTS and how to apply, and then go through questions and answers. And I realized I actually opened the wrong presentation on my computer for the RFP, so I'm going to open my RFQ presentation now.
What?
Do we have the right one up here?
Yes, that's the correct one up there on the Skype call. Okay, so what is the Veterans, Seniors, and Human Services Levy? I know many of you are familiar with this, but the Veterans, Seniors, and Human Services Levy is a property tax levy that was passed by King County voters in 2017. And this is actually the third round of the levy. This third round is the first time that seniors have been included as a specific population group, which is really exciting because it means there's a lot of new investments for seniors living in King County. And the levy is targeted at providing services in 5 results areas for the 3 priority populations of veterans, seniors, and vulnerable populations. Vulnerable populations is kind of a catch-all term for groups like immigrants and refugees, people with disabilities, people in the criminal justice system, and other marginalized communities. And the 5 result areas are housing stability, financial stability, social engagement, healthy living, and system access and improvement. And some of the major guiding principles of the levy are connection, belonging, and what can only the VSHSL do. As a local property tax levy, we have more flexibility with our funds than a lot of other federal and state funding sources, so we're really trying to maximize that flexibility and identify where there are gaps in current services and what we can do to fill those gaps. Equity and social justice is also a really key part of the levy's work, and as well as all of our work at the Department of Community and Human Services and at King County. Our overarching goal is to ensure that all people, regardless of who they are and where they live, have the opportunity to thrive with full and equal access to opportunities, power, and resources. So this is a little bit of background on the strategy. HL2A is the name of the strategy. That's the healthy living strategy, and then they're all numbered with different numbers. So this is the strategy for evidence-based senior health promotion. And all of our strategies for the levy are start from the implementation plan, which is the legislation that was passed approving the levy. And so it's kind of the starting point when we're developing a funding opportunity and putting it out to the community. We start with what's in the implementation plan and then do additional community outreach and research to develop it further. And the way that the implementation plan describes this particular strategy, it talks about, it kind of has 3 main points. that prevalent health issues like chronic conditions and falls play a crucial role in determining the ability of King County seniors to age healthily. Evidence-based senior health promotion programs improve senior health and are cost-effective, but they lack sufficient funding in King County. And significant health disparities exist among King County seniors based on race, ethnicity, and geography. So many of you joined us for the RFP Bidders Conference last week. And as I mentioned, the RFP is really closely tied to the RFQ. So I wanted to share a little bit of background information about the RFP. If by chance you did join this meeting thinking that it was the Bidders Conference for the RFP, we do have the recording of that Bidders Conference from last week available on the RFP ZOOMGRANTS page. So I encourage you to review that for full information about the RFP if you weren't able to attend last week. So the evidence-based senior health promotion RFP will be funding programs that are senior health promotion programs directly serving seniors. Some of the background information that's contained in the RFP that we also talked about at the Bidders Conference last week, I'm going to go through here. So first we have kind of a little bit of background information about what are evidence-based programs. Evidence-based programs are programs developed and proven effective for addressing specific health issues such as falls prevention, chronic disease, medication management, physical activity, etc. And they come as a complete package with a comprehensive program model and supporting curriculum and materials that are ready for implementation in different community settings. The specific definition that the RFP uses for evidence-based programs is one provided by the Federal Administration for Community Living. And it's pretty technical, but it describes, yeah, could you pull that up on the, just so you can see this webpage for the Administration for Community Living that contains the definition of evidence-based programs is a really helpful resource. And if you scroll down to about the middle of the page, you can see the specific definition of evidence-based programs. So this is the definition that the funding that the federal government gives for senior health promotion programs requires that its funding be tied to, and it's also the one that we're using for this RFP. So there's a lot of benefits to evidence-based programs, but there's also some important challenges. Culturally grounded interventions, and then if you can go back to the PowerPoint here. Culturally grounded interventions in communities of color and other marginalized communities are less likely to be evidence-based programs. It takes a lot of resources and research expertise to certify a program as evidence-based. So effective interventions that may exist in communities don't necessarily meet that, haven't necessarily gone through that process and don't necessarily meet that threshold. When programs are evaluated to meet the evidence-based standard, they have to go through rigorous testing and evaluation. But in that testing process, they're often tested in a limited number of populations and under a limited range of conditions. So even though they've been tested and found to be effective, they may not have that same effectiveness in all populations and in all contexts. There's also can be limited room for adaptation. This came up at the Bidders Conference last week for the RFPs. When we're talking about the content, literally changing some pieces of the content to better match with the population that the program is serving. But there's a formal process for approving those adaptations to make sure that whatever the changes are, they still have that same effectiveness that the program has been evaluated and shown to have. So sometimes changes that are too far from the original program content aren't allowed. Further, it can even just selecting a evidence-based program and which one might be the right fit for the population you work with can be a challenge. There's a lot of programs out there, and it can be hard to identify which program might be the best fit. it's also can be challenging to maintain program fidelity over time. It's really important to ensure a program's effectiveness that the protocol for the program, how it works, and the program content is followed as it's meant to be. And often programs include a training component where people get trained and certified to lead a program. But various factors that are pretty common to community-based organizations like staff and volunteer turnover and changes in funding can just make it difficult for programs to maintain strong program fidelity over time. And so kind of keeping that context in mind, the RFP, it looks like maybe someone's cell phone or something is ringing. Oh, yeah, we can do it from internally here. Okay, great. So the RFP is funding 3 different program types. Existing evidence-based senior health promotion programs, new evidence-based senior health promotion programs, including programs that are working towards identifying a specific evidence-based program model or adapted evidence-based program model that matches the need of the senior populations they serve, and existing or new senior health promotion programs that serve senior populations for which existing evidence-based senior health promotion programs are high barrier, few, or non-existent, are aligned with the social and cultural context of the seniors they serve, and are willing to incorporate an evidence-informed approach into their program delivery. So we kind of took what we have. We're trying to support evidence-based programs, but also kind of recognize some of the challenges around the evidence-based programs and provide avenues for programs that may address those challenges to be funded through this RFP. In terms of eligible areas of health promotion, we are funding programs that could address any of these areas: falls prevention, physical activity, healthy eating, medication management, chronic disease management, social connectedness, stress management, behavioral health, or other health-related issues relevant to the senior populations being served. We will be funding evidence-based programs that address falls prevention. That's not the only kinds of programs we will fund, but that is something that we will definitely be funding through the RFP. And one thing we're not funding is evidence-based caregiver support programs. Evidence-based caregiver support programs, that Administration for Community Living page that defines evidence-based programs also has a link, which is also included in the RFP, to a list of evidence-based programs. And caregiver programs are on that list, but we have other VSHSL investments that are supporting caregivers, so that's not something we're going to be funding through the RFP. And then for focus populations for the RFP, the senior health promotion programs funded serve seniors, which is defined by the VSHSL as persons 55 and older who live in King County. And programs that serve senior populations experiencing health and healthcare disparities will be prioritized for funding. For the RFP, applicants may submit requests for up to $200,000 annually. The total funding available is about $6.4 million from 2020 through 2023. And that funding includes some funding from Aging and Disability Services, which is the state designated area agency on aging housed in the Human Services Department of the City of Seattle. The ADS funding will become part of that total funding amount beginning in 2021. So all that information about the RFQ is, about the RFP is to give you some context about the kinds of programs that the awardee from this RFQ would be supporting. So the RFQ is specifically, this is also related to what we were talking about earlier in terms of challenges of evidence-based programs. We wanted to be able to provide the RFP awardees with some real sustained, meaningful support over time as they implement their programs. So that's really what the purpose of this RFQ is, to fund a provider that will be able to provide that kind of support. So there's a lot that we don't know exactly what it will look like yet. But we've kind of based on what we're funding in the RFP and what we anticipate in terms of the kind of supports that programs may need, we provided in the RFQ some examples of the kinds of individualized program supports that the RFQ awardee will be offering. So for example, assisting providers currently operating evidence-based programs to improve or maintain program fidelity, advising providers initiating an evidence-based program or an adapted evidence-based program on program selection, planning, and implementation, supporting programs that don't utilize an evidence-based program model to incorporate an evidence-informed approach, where research-based evidence and other types of evidence can be employed in a structured way to shape program activities and identify program impact, advising and educating programs on other relevant health promotion interventions that might be incorporated into existing health promotion programs, and providing support around evaluation and assessment. And as I mentioned, these are all kind of examples of what we anticipate the RFQ, of the kinds of support that we anticipate the RFQ awardee will be offering to the programs that are funded by the RFP, but there's a lot to be determined in terms of what the specific needs of those programs will be, as well as what the specific capacity of the RFQ awardee is. So this is a little about how that match is going to happen. We also recognize that the RFQ awardee may not really have the capacity to support all the programs that we fund through the RFP. So if we need to kind of select a certain number of programs to be supported by the RFQ awardee, we're going to prioritize the new evidence-based senior health promotion programs and programs that are newly incorporating an evidence-informed approach. So those are the second and third program types as described in the RFP. And it's also going to depend on how aligned the needs of those particular programs are with the expertise and capacity of the RFQ awardee. And that matching will occur during the contracting process. We have determined some specific responsibilities of the RFQ awardee, including collaboratively developing a detailed work plan for program supports, with each of the senior health promotion programs the awardee is supporting, maintaining an engaged, adaptive, and responsive relationship with the supported programs, documenting support efforts, program developments, and updates to work plans, and as necessary, facilitating connections with other relevant information and resources, like culturally specific health resources or evidence-based health promotion program owners, participating in regular check-ins with King County staff, submitting an annual report describing the progress of that year, and then at the end of the funding period, producing a final summary report to King County on the outcomes and learnings of this process. In terms of eligibility, this request is open to nonprofit organizations, community-based organizations, tribes and tribal organizations, and public or governmental agencies serving communities in King County. And we also have some qualifications for the RFQ awardee. So minimum qualifications are expertise in evidence-based senior health promotion programs, strong understanding of social determinants of health and health disparities and inequities, experience providing support around program implementation and evaluation to small community-based organizations, strong background in and knowledge of equity and social justice principles. And then desired qualifications include experience working with culturally specific programs serving marginalized communities, such as communities of color, Native and Indigenous communities, and immigrants and refugees, experience with community engagement and partnership and with incorporating participant feedback into program design and delivery, and openness to and knowledge of evidence frameworks other than research-based evidence, such as practice-based evidence and community-defined evidence. And we have some definitions of those terms at the bottom. Community-defined evidence referring to a set of practices that communities have used and determined to yield positive results as determined by community consensus over time, and practice-based evidence referring to local program data to learn what's happening in community practice. In terms of the funding available, up to $1 million is available for the program period of July 1st, 2020 through December 31st, 2023. Applicants in the application process will be asked to develop and provide a proposed program budget that's not to exceed $250,000 annually. And we contract on a biennial basis, so the end of our biennium is the end of 2020. 2021 and through 2023 funding is contingent on approval of the King County Council budget. We don't anticipate doing another RFQ process, but there's always contingencies about the availability of funding for future years. In terms of our timeline, the RFQ was released about 2 weeks ago. The bidders conference is today, and then the RFQ will be due on March 30th, Monday, March 30th at 11:59 p.m. We asked for questions by the last day for questions is a week before the RFQ is due, so that's Monday, March 23rd. In April, the responses will be reviewed and rated. We may conduct interviews with applicants if we decide that's necessary, so that would happen in April or May. The notification of award decisions will happen in May, and then we anticipate the contracts to start July 1st. So again, the proposals are due by 11:59 on Monday, March 30th, and all our applications are available on the King County ZoomGRANTS page, which is an online grants platform. So completed submittals on that platform will include responses to the summary questions, which are kind of broad general questions about your organization and where it's located and your budget and things like that. Responses to the narrative questions, which is really the questions about your program and your proposal, and then a budget, which if you have experience with other VSHSL investments, other investments usually ask you to complete a budget form that we provide to you. For this RFQ, you will provide your own budget form. And then the rating criteria are detailed in the RFQ. So if you open up the RFQ,
Can you get that open now?
yeah, sure, that would be great. Thank you. If you go down to page.
We got our RFQ on the application. There we go.
Oh yeah, I think it's page 10.
Yeah, okay. Here?
Maybe.
Was it up here? Oh, yeah, the rating
Some of
criteria.
the rating criteria, yeah.
I think it's somewhere. There we go.
So this is the rating criteria that they match exactly to the narrative questions. So it kind of describes what a really strong answer would look like and the total point value for that answer. And then you can match those to the questions. I do want to note that we have some questions that are not scored. So there's a question about asking you to provide an overview of your organization and your programs. That's not scored. And then there's a program scope question that's asking you kind of basically about what is your capacity, how many programs do you think you could support? And we're not scoring that because we just want to get a realistic sense from you of how many, how much work you can do with this amount of funding. And then here's a little bit, the next slide has a little bit more information about ZoomGRANTS. All the RFP materials are posted on ZoomGRANTS. If you look in the library tab, that has all the attachments of the RFP as well as the questions. RFQ. And then all applications must be filled out and submitted via ZoomGRANTS. Questions that come up at the bidders conference today will also be posted to ZoomGRANTS in the library tab. And the link to access the ZoomGRANTS page is right there.
You want me to pull up the ZoomGRANTS page?
Sure, that would be great. Thank you, Adam. So this is the ZoomGRANTS page. Description, kind of some basic pieces of information about the RFP. are written out there, and then down at the bottom is the library with the attachments that you can download. And then, yeah, so you can, so even though you can download the summary questions and narrative questions here, but in order to complete your application, you'll have to put your answers into ZoomGrants. There's kind of a forms where you fill out your answers to those questions.
Anything else you'd like to show?
And then maybe just if you go to the bottom where people can see the summary questions and narrative questions tabs, yeah. So that's when you're ready to submit your application, and upload your information. That's where you'll fill out the information and then submit it. Yeah, and this is where you'll need to upload your program budget.
Anything else here?
Okay, I think that's it. So now we have time for questions.
And we had someone else join us in the room.
Yeah, before we do that, thank you. Would you like to introduce yourself and let me move this one?
My name is Deidre Barrow. I'm Program Director at ARC, which is African Americans Region Teach Health Ministry located in
Cool, thank you. Okay, so for questions, Adam, what do you think, is there a best way to do this? Or people just speak up?
No, I'm seeing a few people type, but I think we have people speak up, and then I'll read out any questions we get written as well.
Okay, sounds great.
And we actually already just got one in, if you want to take that.
Sure.
So the first question we have is from LW. I didn't catch that person's name, but can you advise if the character limit includes spaces? I think this is referring to the ZoomGrants portal itself.
Yes, it does. It does include spaces.
So when you're answering your narrative questions. And it looks like there's an active counter there as well that will count down how many characters you have left, which is helpful.
Yes.
So the funding is available, from what I read, to support existing programming or for new programming. What about a combination of the two?
Yeah, so the question was that the funding is available to support existing program or new programming. What about a combination of the two? So I just want to make sure that, so this is the bidders conference for the RFQ, which is, it's a little bit different than the RFP. And I think what you're referring to is in the RFP.
Okay.
The program types, the existing or new program types. It all came out in the same email, so we thought folks might get confused about which is which. But so I'm not sure, Tracy, is the best way to,
I would, and tell me if I'm answering this wrong. The entity that is awarded this from the RFQ for supporting the evidence-based programs that are available would support any of the three types of programs.
Yes, but I'm wondering, were you asking from the RFP side?
I don't know now.
Okay, yes. I think that might have come, because I think a lot of, they're really closely related.
Okay.
So we were anticipating that it's possible some people might come to this bidders conference thinking it was about the RFP. Okay. So while the RFP is about kind of health promotion programs that are directly serving seniors, this RFQ is for an entity that will support those programs. It's not for the program.
Okay, I remember that now, that there is,
So I think for you and for just everyone on the call, maybe to keep it clean, if you have questions about the RFP, you can ask them here and we can note them down. But I think because this is the bidders conference for the RFQ, the way we'll address those questions is just by posting the answers. We won't answer your questions now, but you can ask them and then we'll note them, and then we'll post it as a document on the RFP ZoomGrants page.
Okay.
So yeah. Okay.
And I got another question via Skype. If you want to handle these, because they're easy to kind of knock out. Can you advise if unobligated funds can be carried over from year 1 into year 2? And this is LW again.
For the King County's fiscal or we have a kind of, I'm forgetting the term. We work on our budget works on a biennial basis. So the end of that biennium is 2020. My understanding is that there's going to be we're not really going to be able to carry over funding from this biennium to the next biennium. So that means from 2020 to 2021. But I can confirm that. And like I said, we'll be recording all these questions and posting them on the RFQ page. If it's RFP related, we'll record those and post them on the RFP page. But so you can check back there after we do that to get a final answer. But my understanding is that we won't be able to carry over money from the end of 2020 and through 2021.
Those are all that I see on the Skype call, though more are coming in, so you can feel free to take any others you'd like.
Does anyone who's on the phone have any questions they'd like to ask?
Yes, this is Michelle from Providence. We have a couple of questions.
Sure, go ahead.
The first question is specific organizations or researchers have to be, submit RFP or RFQ, or can be both applied at the same time?
Organizations could apply for both the RFP and the RFQ. They don't have to, yeah.
So, and then another question is about the RFQ. I look at briefly about the application. It's for particular one question is asked for like you need to declare which council district needed to be served. So as an organization, we have like kind of service, spread out to the King County. So in that case, can we say it's going to be applied to all council districts?
Yeah, I think you can select if your program is in multiple council districts, you can select multiple.
Or unless we need, I think my follow-up question is have to be specified into one district or the other, because some clear cut for the service boundary as exact like the council district, jurisdiction's boundary.
I believe there might be two questions. One is where your organization resides, and that is one specific council district. But the council district you anticipate serving, you can select more than one. And if you don't have specific ideas about that, you would select the ones that you think are most obvious for you to have served. And we have had groups that select all.
Okay. So I'm sorry, one more follow-up question. Just if, for instance, the headquarter office is located other than King County, outside King County or the Washington State, can we still apply? Submit our application?
If your headquarters are located outside of King County or outside of Washington, can you still apply? Is that what you're, okay. I believe so. I think you just have to. But I believe so. I think you just have to have a location here, but we'll confirm that in the answers.
All right, thank you.
If you have a strong presence in King County and a basic office in King County. Providence.
Okay, yeah.
We got another Skype question here from Ann Turner. The question is, what is the anticipated balance between providing technical assistance versus program evaluation?
I would say that's still to be determined based on which programs we award through the RFP and what their particular needs are. And that the work plans that the awardee of this RFQ will develop will be a collaborative process between the RFQ awardee and the particular programs. So that will be something that will be determined through that collaborative process. Okay, and I do just want to encourage you, if you attended this bidders conference thinking that it was the RFP bidders conference, please check out the ZOOMGRANTS page for the RFP. You'll find we'll be posting the questions asked at that bidders conference shortly. The recording of the bidders conference from last week is already up there, so you can listen to that and see the presentation from last week. And then if you do have any questions about the RFP that you want to just put out here today, you can. And while we won't answer them now, we'll post answers to those questions.
Sorry, this is Michelle again. I have just one more question.
Sure.
How many proposal or how many organization will you consider, or how many applications will you be considered or funded?
For the RFQ, we will only be funding one organization.
I see. Thank you.
Thank you. I should have mentioned that in the presentation. Yeah. Okay. Well, if you do have any other questions that come up, please feel free to email me. My email is vweihs@kingcounty.gov. That email address is also on all the RFP materials. Sorry, I keep saying RFP, but I mean RFQ. And we can't answer, when the RFQ is open, we can't answer questions on an individual basis or have individual conversations about the RFQ. But if you email questions to me, then I will write up the answers and post them publicly on the RFQ Zoom grants page so that everyone has access to those questions and answers. Okay, thank you for joining us.